Hi, I'm April Ash, and I'm going to talk on the topic of communication skills and interpersonal dynamics. So it's important with communication skills when you're talking to someone that you hold judgment. So you do not judge them. You have an open heart and you're truly listening to what they're saying without bringing your own prejudices and biases into the conversation. So you put your personal beliefs, values, and thoughts on hold while you listen to someone else. You remain calm and keep facial expressions neutral. So you don't react to what they're saying. You just take it on board and you listen to the person in full. You do not interrupt unless to clarify or reflect on what they're saying. So you do not interrupt them unless you need to clarify that you've understood a particular point or to reflect on something that they're saying. So reflecting is a technique to ensure that you have heard the information correctly or to repeat what you have heard. You may wish to reflect a similar short experience of your own, not a long story that discounts the other person's narrative. So you want to either build on what they're saying or validate their feelings or their experience within that situation with something similar of your own. But you don't want to discount what they're saying, so invalidate their feelings. And you don't want to make the conversation about you. So there's a fine balance in reflecting. You can also clarify. So clarifying is the technique to ensure you have the information correctly and understand the content. So it's used when the patient or client's story gets muddled or confused and you don't feel like you've got the entire picture. So in order to put the pieces together, you may relay some of the information that you've heard and ask whether that's correct. Something along the lines of, I'm not sure if I'm getting this correct, but from what you're saying, this is what I've heard. Is that correct? So you're clarifying to make sure that you're on the same page. Summarizing and paraphrasing. So paraphrasing or summarizing is synthesizing all the information you have heard and repeating this back to the client in your own words. So it's saying, yes, I've heard what you've said and this is how I've digested it. Is this correct? It should be clear, succinct, contains all critical elements of the narrative story. So sometimes when people are telling you a story, it comes out all jumbled. And once you've put all the pieces together, you can paraphrase that in a neat, coherent, sentence or a few sentences back to the client or the patient to see if you have that whole story. And it also shows them that you have been listening, you have been digesting what they're saying, and this is what you've gotten. Sharing. So it is permissible to share concise, relevant experiences. However, do not over-disclose because it impacts the client-professional relationship, for one. We should be impartial and we should refrain from giving too much information about ourselves that's unnecessary. It changes the dynamics of the therapeutic relationship. This is not a friendship, so there are boundaries. It can lead to trust issues and counter-transference issues. So transference is when a client identifies the health professional with someone else. So from the stories that you're telling or just from your appearance, they can relate to you as being similar to someone else in their own life and they project that onto you. So commonly the health professional is viewed as a parent. So they will project their parent onto you, and it may occur because of unmet needs of the client. So these unmet needs resurface in the presence of an empathic helper. So you represent that person for them. And transference can be positive, negative, or mixed. But it's good to be aware of it, even if it is positive. It's good to be aware that these dynamics can happen. And when you're in such a vulnerable situation with a client where they are telling you pretty personal information that's putting them in a vulnerable position, that these sorts of issues can arise where they do project certain aspects of people onto you. But there's also counter-transference where you do the same to the client. So there may be clients or patients that you meet, that you're working with, that reminds you of someone in your life, and you get that kind of gut feeling that you get when you interact with that same person in your life. So when a health professional has personal, non-professional feelings and reactions about a client, so it usually occurs when there is something about the client that reminds the worker of someone who is well known to him or her in their life. And counter-transference may be positive, negative, or mixed. But once again, it's important to be aware of it and whether it actually is affecting your practice or your interactions with that client or patient. Counter-transference may lead us into adopting an unbalanced attitude towards our clients. And if we're aware of this and we realise that there is an unbalanced attitude towards our clients, we may not be the best person to help them. So it's important to be aware of this and to refer these clients, patients on if we are in this position where we can't be impartial.